I'm Dr. Josh Satterlee from Biomechanics in Las Vegas. Again, we're talking about injuries we commonly see. And here in Las Vegas, we have the Rock and Roll Marathon in December. And for the 2 months before that, we'll see plenty of people with IT band syndrome. Now, the interesting thing about IT band syndrome is oftentimes it's thought of as a friction syndrome between the IT band and the lateral condyle of the knee. The cases that we see, though, do not have pain at the knee usually. Oftentimes they do, but most of the time what we see is they have tightness along the side of their thigh, on the lateral side. So we're going to talk about that and kind of an idea to think about with IT band syndrome that I think gets overlooked a lot. The IT band does many roles. It functions as a stabilizer. It reinforces the femur as a strut on the outside of the thigh. It also helps stabilize the knee and stabilize the hip. Many functions there, but it's pretty amazing at what it does. When it becomes inflamed, you all of a sudden realize how much it really does because every step bothers you. So we're looking at the IT band and the thigh. So if we have somebody's thigh here, of course the IT band goes on the outside here. But what often gets overlooked is this IT band needs to move separate or independent of the layer underneath, which is a muscle called the vastus lateralis. It's one of your quadricep muscles. What we see a lot of times, if this is the vastus lateralis, this would be our knee right here, the vastus lateralis and the IT band sometimes become fused within here, or they have increased amount of friction. They don't slide like they should. The problem with that is they need to move at separate times. Your vastus lateralis is contractile, it's a muscle, so it's going to shorten. The IT band is mostly tendinous and therefore won't shorten. But when you get this shortening of this muscle, if it has this adhesion here, it tensions the IT band this way, pulling on that insertion point down past the knee and creating a lot of tension within there. So one of the things we try and do is separate those two. Now it's often difficult to think about, but if we think that with knee flexion the vastus lateralis should lengthen, the IT band won't necessarily lengthen with that knee flexion. If we bend the knee, maintain a contact in that IT band, and then adduct or cross the leg across the center line, you'll get a separation or a pull. Plus the difference, if the axis of rotation here, the IT band is lateral to the vastus lateralis. I'm talking a lot of nerd language here, but it's basically going to pull one layer off of the other or mobilize that one layer. Once that happens, again, people often stand up and say, yeah, that feels different. That feels like what I need. When you're lucky, that gets them better in about one treatment. When sometimes these symptoms have been around for a while, it may take 6 treatments. But you'll notice you can put all the heat and ice, ultrasound, e-stim, all that, those modalities on that leg, nothing's going to change. We're going to take you through an active range because that's when the problem arises, when you're being active, when you're running or skiing or jumping or cycling. And we want to take you through that and treat you in that. So if you have IT band, you should really find somebody in your area that does active release. If you're here in Las Vegas, give Biomechanics in Las Vegas a call and we'll take care of you.